Thanks for staying with us. We are staying on health matters, and we have the Federal Director and the National Coordinator, National HIV/AIDS, Viral Hepatitis and STI Control Program, Dr. Adebobola Bashorun, joining us now on the news at 10. Thank you so much for joining us.
Good evening. Thank you. Good evening.
So let me just get your thoughts on the recent 4.8 billion naira that was approved by the Federal Executive Council for HIV treatment in the country.
Yeah, thank you. I think it's a very laudable and a welcome one. It shows that we have a government that is working, a government that understands the needs of its people. And this is one of the landmarks in recent times where, in a quick turnaround, within a short time, the government, under the leadership of the president, has been able to quickly mobilize resources to address the probably expected gaps that could arise due to the change in policy statements from the one of the donors in the country. But you know, the government has always been supporting HIV, and we don't just give to donors alone. But this time around, this is a quick one, a quick emergency response, and I think everybody must commend the leadership of Mr. President and his ministers. And it shows that they know what's going on, they listen to the people, and this 4.8 billion definitely will reduce a lot of gaps and ensure that we have stocks for antiviral drugs, the main first-line drugs probably, and that will last for a couple of times in Nigeria. Currently, we have some stocks, but this one we have to the stocks we have in Nigeria, and make sure that we have any stock out for those living with HIV in Nigeria.
Now, just talk to us about how big the HIV response is in the country in terms of what could be lost if funding should cease.
Yes, thank you. As a country, now, right, Nigeria has done pretty well in terms of putting people on treatment. You know, the prevalence, and when I mean prevalence, it means it's difficult to explain about. Let me just say the proportion of people living with HIV amongst 15 to 49 years is just 1.3%. That's what we call prevalence. And it shows by the time you calculate it out, you have about 1.9 million Nigerians that are living with the HIV. And currently, we have over 1.6 million on treatment. And they've been on treatment, a lot of them virally suppressed. It means they cannot transmit from one person to another because the drugs they are using, the active TLD drugs, they've been able to reduce the transmission rate of the virus from one person to the other. But despite that, we still have a lot of prevention activities that we are doing together to address this. So, based on the current pronouncement, definitely, if we don't have this support from the federal government, we may have a situation whereby we run out of stocks and people that were virally suppressed before, we have rebound virus in their system. So we tend to have to maintain the progress we've made. And once we maintain that progress we've made, definitely we won't go back.
Dr. Bashorun, apologies for butting in, but I just wanted to stay on that point in terms of the progress we've made, because one of the conversations over time is that there's been need for us to locally or domestically fund our own interventions for diseases like HIV and AIDS. And we see what's in some of the policies by President Donald Trump. Do you think that this pause on the U.S. funding is like an eye-opener to do more inwardly?
So I will start by saying, first of all, the U.S. government has tried, they've supported the country for close to 20 years. And I can also take categorically that the government of Nigeria has a lot of plans on ground. This current administration, under the renewed agenda, we call the Health Sector Renewal Initiative, it has looked at issues around unlocking the healthcare value chain, local production of drugs, local production of test kits, and we have a national coordinator that is handling that already under the leadership of the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate. So in terms of, even before we thought of this pronouncement from United States, Nigeria has already thought ahead to set up a system that will unlock the value chain and ensure that we have backward integration of technology for production in Nigeria. And so maybe it's just a coincidence, or Nigeria is more proactive in its approach to some of this. And I said, even assuming President Trump didn't come up with this statement, I'm telling you, within the next let's say 2 years, Nigeria will so self-sustaining in this, and we can be able to produce enough drugs, enough for at least for the region. So we're already thinking ahead on this line, even before this pronouncement came up. So
I mean,
made progress in terms of policy.
That sounds like good news. Hopefully, we'll begin to see a reduction in
even
HIV
the president
burden in the country.
If you don't forget.
Dr. Bashorun, my apologies. I know that this is something you're passionate about, but we do have to leave the conversation there. The Federal Director and the National Coordinator, National HIV/AIDS Viral Hepatitis and STI Control Program, Dr. Adebobola Bashorun. Thank you for your time.
Thank you very much. Thanks for having me. Thank you.